At our thyroid recovery seminar, okay, I'm going to be talking about the ways that the thyroid can not be working properly. I'm going to give you just a brief overview of that. Where can the thyroid possibly go wrong? Well, number one is in the thyroid gland itself. Maybe it's damaged and it's not working properly. That is possible, but it's not the most common thing. So where else could it go wrong? Well, it's possible that you could actually have a problem in the brain from the pituitary gland or the hypothalamic area, which is what controls hormones. It could be not turning the thyroid on. So that could be a problem area. If you had that, your TSH would go low. If you had this, your TSH would go high. Well, what else could you have? Well, you have two hormones that are made primarily in the thyroid, and that's T4 and T3. So 93% of that's made is T4, but the active form is T3. So T4 is not active. So how do you get from T4 to T3? There's other things that have to happen. It has to be transported through the blood to the liver on what's called thyroid binding globulin, which if that's not at the proper levels, that can cause a problem. Then it has to go to the liver and the gut where it is converted from T4 to T3. 60% happens in the liver, so that could be number 4, our problem, or the gut, number 5, okay, because 20% is also converted in the gut. And then lastly, guess what? It has to get into the cell. And the cell has a receptor here. If that receptor is not open, you cannot get T3 into the cell to make the cell work. So you have low thyroid symptoms, even though your labs may look normal. That is 6 of the 7 reasons, but the most common reason that people have thyroid symptoms is because of an autoimmune condition called hypothyroidism or Hashimoto's, and that's not a thyroid problem, that's an immune system problem. We'll be going through all of these at our seminar on May 1st here in our office in Kingwood, 6 p.m. Join us. I look forward to seeing you then. Until then, live life well and God bless.